Hello everyone. So in this video we are going to see about passive movement for lower limb. So what are the joint structures responsible for a lower limb are hip joint, knee joint, ankle joint as well as subtalar joint. For hip joint there are six movements. What are they? Flexion and extension, abduction, adduction and rotation, and then medial rotation and lateral rotation. So there are six joint as well as these all together combined as circumflexion. So first of all we are going to see about flexion for hip joint, passive movement of flexion. So how to be position for the flexion of hip joint, or the patient should be in supine position and the therapy should be in walk standing beside the cot or couch. Okay, so in this சிரிச்சிட்டான் So in this, for flexion of hip joint, purely for flexion, we want to hold a leg for our position. To make comfortable for the patient, we want to rest the patient's leg in our forearm. Okay, so like this we want to rest the patient's leg on our forearm and want to hold the knee and under the knee for buckling, restrict the buckling. Okay, so for pure flexion we want to hold like this and we want to extend. So now we are going to see a hip flexion. For purely hip flexion we want to place a patient position like for hip flexion we want to rest the patient leg in our forearm like this and want to place our hand under the knee for restrict the buckling of patient's knee while doing the hip flexion. So now we want to do a hip flexion. Purely hip flexion is like to be just increase the range of motion like this. For purely we can do a hip flexion. Okay, for hip flexion as well as knee flexion we want to hold the patient's knee under like this and we want to place our palm under the heel, another hand on the under the knee. Okay, so now we want to give flexion. See, while doing flexion of hip and flexion of knee, the therapist's hand should come laterally. While doing extension of the hip and knee, the hand should go under the knee to restrict the overbuckling of knee. Okay, so this is for hip flexion. So hip extension, prone, go for prone. So for hip extension, we want to place our hand on under the knee and one hand on knee, one hand on ankle like this, and you want to do extension like this. Okay, do like this. Yes, so fine. Next, abduction. The abduction of the patient's come to edge. Yeah, super. Keep your legs like this. Okay. The abduction of the hip, we want to hold our hand on under the knee and another hand on under the heel. Okay. So now we want to do, see, abduction, adduction. So on both you want to do like this. Okay. Abduction as well as adduction. This is abduction and adduction. For internal rotation and external rotation, you want to flex the knee and hold under the knee on one hand and hold our heel, patient's heel on the another hand, and we want to do internal and external rotation. Okay, like this. So this is the major movements. Combining of all these movements, we can do circumflexion on the hip. So likewise, we want to flex the hip and knee. We want to flex the hip and knee and lateral rotate the hip head of the femur, and we want to go for flexion, then internal rotation, then you want to come for extension. So this is the overall circumflexion. Overall movements combined on the circumflexion of hip. Like this: external rotation, flexion, internal rotation, extension. Okay, so this is for hip joint. For knee joint, there's two movements: flexion and extension, and tibial rotation. So for flexion, for same as hip flexion and knee flexion, we want to hold one hand on under the knee and the another hand on the under the heel. So we want to flex like this. Flexion and extension on the same passive movement. It will come like this. Okay. So for tibial rotation, you want to hold the patient's knee under the knee like this, and another hand on the anterior aspect of the ankle. Okay, so keep loose. Yeah, super. Yeah, keep your knee on my hand. Okay, rest your hand. Rest. Yeah, super. So now we want to turn the tibia. Likewise, it's a minor movement. You want to turn the tibia like this. Okay, we want to give 5 degrees of flexion on the knee for a tibial rotation. On the knee locking, the tibia will get fully internal rotation, so we can't able to do tibial rotation on the knee locking. Okay, so for ankle joint, there is an dorsiflexion, plantar flexion, inversion and eversion. On ankle there is two movements only, which are dorsiflexion and plantar flexion. On subtalar joint, there are two movements which are inversion and eversion. So we see for ankle and subtalar joint movements on the next video. Thank you.